Welcome back to the Michael Baisden Show. As you all know, we're talking about domestic violence today, but I had to take some time, George, to talk about the teenagers because 25% of the teenagers are experiencing being battered. And Dr. Janet Taylor's on. She's a licensed clinical psychiatrist, and she's going to help us understand this. I want to talk first, Doctor, about the parents because they're the ones who's tuned in right now. What do they need to understand about their battered teen?
Well, parents need to understand that the roots of violence start with what kids witness, and so what we expose them to as parents, as adults, plays a big part in their role in terms of what they think is acceptable in relationships.
And what are they seeing? Your experience with the kids who are involved in this, what are they seeing at home?
Well, from the parents' perspective,
yes.
It's really, being battered, if you are the one who's being battered, can be a very embarrassing, guilt-filled, you feel like it's your fault. Right. So parents may not realize what's happening, but what they may notice with their child is that they may be more depressed, more withdrawn, there may be changes in school, or with technology, you have especially girls who feel like they have to be attached to their phones because their boyfriends will not let them have any minutes alone, and there's a lot of anxiety if they can't immediately be contacted.
Because I want to make sure the parents, George, this is very important. I want to make sure the parents who are listening right now have some help in terms of how to identify their child as being battered. So you're saying being tied to the phone and what else, Doc?
Well, I mean, if you see changes in their behavior, they may be more depressed, they may be more irritable, and you just can't put your finger on it, then you need to ask about the quality of their relationship and what's going on, and also pay attention to your intuition.
Isn't that a part of the problem is that parents are not paying attention to their kids, enough attention to what's going on in their kids' lives?
Well, it's a big problem. As a parent, I have 4 daughters myself. We love our children, we care about them, but from a family time where we just sit down and check in and see how everything's going, certainly that has gone out the window. Studies show on average parents spend less than 10 minutes a day actually talking to their kids.
Dr. Janet Taylor, who has 4 daughters, it's great to be talking to you about teens. How did you get involved in the teen aspect of domestic violence, Dr. Taylor?
Well, obviously I have children, but my practice is primarily community-based, and so I work in the Bronx with families, adolescents, and teens, and also with a lot of adults who have children. I
want to hear some of the stories, and maybe that, because a lot of times that helps crystallize things for us. What kind of stories can you tell us about what's happening with these teens?
Well, what kids and teens don't realize is that when we think domestic violence, we think it's just a physical aspect, but it's emotional abuse. And the number of teenagers, especially girls who come in and talk when you ask them specifically about how their boyfriends talk to them, and the feelings of low self-esteem, it's really heartbreaking. The other part is domestic violence also includes sexual abuse in terms of forced sexual activity.
Yep.
And so when you really probe into the relationship and what it's like, how they met them and how they feel, that's what you find. And I think as girls anyway, sometimes it's harder to find your voice and to speak up. And so part of my practice is really getting young girls especially to speak up and not neglecting the fact that there are some girls who abuse boys.
I know.
And for young men,
talk about that.
That's even more, like, how are you going to say my girlfriend's hitting me?
Hold on that one. We're going to save that one for next week. I want to continue in this conversation about what's going on with the teen girls and the sexual abuse as well. How can the parents identify that, though? How do we know as parents this is going on, particularly when it's sexual abuse?
Well, we have to start early talking to our young men and women about sexual behavior, what's appropriate, what's not, when you feel comfortable and when you don't. And sometimes it's not the easiest thing to talk about. However, there are medical professionals that you can take your daughters to. So take them to a gynecologist and make sure that they're talking to them about sexual activity, or their pediatrician. Understand you don't have to do it yourself, and your kids may not feel the most comfortable talking to you, but at least put them in the position that they can talk to a healthcare provider openly and honestly and get real information.
Well, Doc, you got 4 daughters. At what age did you start talking to your daughters about this?
I started talking to my daughters about sex when they were around 5. Not sexual activity.
Sexuality, yeah.
But good touches, bad touches, private parts are private. And then obviously as they got a little older, my girls are all, my youngest is 18, my oldest is 24, then we could talk more about the relationship. But it's always about building their own confidence and knowing that they can always talk to me whenever they want. Not that they do all the time, but they know that they can.
But they know that they can. Thank you very much. Dr. Janet Taylor, we're going to talk to her again next week about the boys, too. We got to talk about battered boys. Come back with more of your calls on domestic violence on the Michael Baisden Show. Welcome back to the show. It's Michael Baisden talking about domestic violence. Dr. Janet Taylor's on the line, and as you all know, she has 4 daughters. The youngest is 18, so she's had her experience with 4 girls. But you talked last week about the boys, and this is something no men want to talk about. And I was looking at some of the statistics. It's like 5.4 million men are being abused.
That's a lot. That's a huge number.
Yeah,
I was
that's
so
a huge
surprised
number.
when you said that. Yeah.
So
Yeah.
what do you tell the boys about that?
Well, you tell the boys the same thing as the girls. There is no reason for anyone to ever put their hands on you. And again, the same for domestic violence. It's emotional, it's physical, it's sexual. If you feel uncomfortable in a relationship, then you need to either get out of it or talk to
It's
someone
harder
about
for
helping
boys,
you
Doc,
get out
because
of
we
it.
get called, they're getting called punks and sissy and all kind of bad words.
And it's a catch-22 because if they fight them back, then what?
Exactly, but I think you have to look at what is this relationship doing to you, and that, there's that catchphrase that love shouldn't hurt. If you're in love with someone, you're their boyfriend or girlfriend, they should make you better. They should make you feel supported. If you're in a relationship where you feel worse in it than out of it, you have to get out of it. Handling feelings, handling conflict with violence of any kind cannot be tolerated, and that goes for on the street and also within your home and in the confines of a relationship.
Dr. Taylor, where's the violence from the girls coming from? If they're seeing the abuse, can they become abusers even though they've seen their mothers be beaten?
Absolutely. It's all about exposure. And, there are certain risk factors, certainly, that make people more violent. If you come from a low-income home, if you're a single parent, in some cases different ethnic backgrounds are maybe more violent. And also the fact that, a lot of our young girls are seeing their mothers being raised with it alone. And so you have to think, what do I sacrifice just so it won't be by myself?
Yeah.
And I think our young girls and young women have to understand, it's okay to be alone. You don't have to put up with domestic violence, emotional violence, or abuse, and we teach them that early. But what do we see our own, mothers with? Because they want somebody, in their bed or on their arm.
How does she become a person who hits if she's seen her mother be hit?
Because it's all about, when kids, the way that kids and teenagers, a lot of times they can't find the right words. I'm depressed, I'm upset. And so kids and teenagers will externalize how they feel. And just like as you see young kids, they may be frustrated, they're throwing toys and hitting.
Gotcha.
It's the same kind of pattern that can happen. Wow. And so again, what you want to do is teach our kids to understand what they're feeling and to express it in a way that can come to some action that doesn't hurt them, not just when they're frustrated they're going to hit. Use your words.
I got one more question I need to ask you. I know we're going a little long on this, but I got to ask. Is there any truth to the fact that young ladies who have fathers are less likely to be beaten?
Well, we underscore and we.
And the reason why I ask that is because George and I are dads, and men always say, nobody would ever put their hands on my daughter.
No, but it's not the fact that they're less likely to be beaten. When a father's involved, and the father doesn't have to be in the home, but a father needs to be involved and check in. Kids do better academically. They have sex at a later point. They're less likely to get involved with alcohol and drugs, and certainly would have a more substantial emotional relationship with someone else. We don't pay enough attention to the importance of fathers in our kids' lives, and because we put so much emphasis on it has to be someone living in the home, fathers just need to check in and stay connected.
You got that right, because I check in every day. Thank you very much, Dr. Janet Taylor. If you all want information about us on Baisden Live on Twitter and Baisden Live on Facebook, and please share her blog. We put it on Facebook. You can hear the whole interview of the conversation we've had with Dr. Janet over the last 3 weeks. Coming back with more of your calls on domestic violence on the Michael Baisden Show.